The straight leg raise test is performed to determine the presence of nerve root compression syndrome and/or neural tension. Before beginning the technique, the clinician should ask the patient if the symptoms are localized to a certain side of the body. If there is a more symptomatic side, then test the less symptomatic side first. If the less symptomatic side elicits pain or discomfort, this is a positive cross straight leg raise. Please refer to the manual for additional details. The clinician is looking for reproduction of neurological symptoms in the 30 to 70 degree range. Symptoms include radiating pain in the posterior thigh or calf, usually in a radicular pattern. The patient may report a sensation of numbness, tingling, pins and needles, or generalized pain and discomfort. The clinician should place one hand on the posterior ankle and the other should be placed on the outside thigh just above the knee. The patient's leg is passively raised into hip flexion with the knee in full extension and the ankle in a neutral position. Once the patient begins to feel symptoms, the leg should not be raised any higher. To differentiate whether the symptoms are neurological or musculoskeletal in nature, the position is held for 10 to 15 seconds. The symptoms may worsen over time if they are neurological. If the symptoms decrease over time, it can be musculoskeletal and secondary to the stretch and elongation of the hamstrings or gastrocnemius. To help determine if the hamstrings are on stretch, the clinician can palpate the muscle near its insertion. To further distinguish neural tension from muscle stretch, the leg can be lowered to a point just below where the patient experiences symptoms. By dorsiflexing the ankle just before the onset of symptoms, neural tension is increased on the tibial division of the sciatic nerve at the knee and ankle. This can increase neurological symptoms in the posterior thigh, lower back, or calf. By asking the patient to flex the neck with the ankle returned to neutral, cervical flexion can increase neural tension on the lumbar nerve roots. This can worsen neurological symptoms as it places additional stress on the dura and lumbar nerve roots. Symptoms elicited by any of these positions can be documented as a positive straight leg raise test. If symptoms begin after 70 degrees, the cause is usually not neurological and may be attributed to reaching the ends of hamstring or gastrocnemius muscle length.